Good afternoon, everyone. My name is Julie Kim. I'm currently an MIS fellow at the University of Nebraska Medical Center in Omaha, Nebraska. I wanted to thank SAGES for the opportunity to share our study regarding the association of changes in Herqles score with objective hernia outcomes. I have nothing to disclose. A little bit of background. Following ventral hernia repair, there are objective and subjective measures of success. Success of a surgical intervention is often measured by hard clinical outcomes. However, there's limited data in subjective measures. Some of the examples of objective measures include hernia recurrences, readmissions, reoperations, as well as wound events. And one of the ways to measure subjective outcomes is through a Herqles questionnaire, which I'll be talking more in detail in the next slide. The purpose of our study is to determine if there is an association between a 30-day wound event, which is an objective measure, and the Herqles score, which is a subjective measure, using the ACHQC database. And our hypothesis was that there would be a positive association between lack of wound event and increase in Herqles score. So this is a Herqles questionnaire. It assesses patient-centered abdominal wall functional improvement after ventral hernia repair. It contains 12 questions as seen here that quantify the effect of abdominal wall on a patient's daily activities on a scale of 1 to 6, with 6 corresponding to the most positive impact on the quality of life. The raw score is then converted to a standardized score ranging from 0 to 100, with scores closer to 100 corresponding to a better quality of life. Our inclusion criteria was obtained from the ACHQC database over 11-year period interval, consisting of adult patients who underwent ventral hernia repair, whose 30-day follow-up data was available. The 30-day wound events that we investigated were surgical site infection, also known as SSI. It includes superficial, deep, and organ space infections, and surgical site occurrence, which was first described by Ventral Hernia Working Group in 2010, and it added wound events that were not captured by the term SSI. Lastly, SSOPI stood for SSO requiring procedural interventions, and these included antibiotic treatment, wound debridement or opening, percutaneous drainage, or partial or complete mesh removal. Propensity score matched analysis was performed to investigate the association between Herqles score and 30-day wound events. There were 2 groups, those who experienced a 30-day wound event and those who did not. And these 2 groups were matched using 1-to-3 ratio. To further quantify the association between the Herqles score and 30-day wound event, logistic regression models were analyzed. These are our results. At the time of the study, the database contained over 125,000 patients from 324 surgical sites and 353 surgeons ranging from academic, private practice with academic affiliation, and our inclusion criteria ended up with 40,000 patients. And after matching, we ended up with over 17,000 patients. And of these 17,000 patients, about 25% of them experienced a wound event at 30-day interval, and 75% of them did not. So this graph demonstrates the balance of baseline covariates before and after propensity score matching. The standardized mean difference, less or equal to 10%, indicates that the groups were well matched, as indicated by this pink arrow. The next 3 slides will include patient demographic variables as part of the descriptives for match data. We have 2 groups, no 30-day wound event group, as well as a 30-day wound group. And the p-value was noted to be statistically significant if it was less than 0.05. Over here, we have sex, race, age, and their smoking status. And out of these variables, age was noted to be statistically significant. Here we have some comorbidities, including hypertension, diabetes, COPD, patients who are under immunosuppressive therapy, in addition to length of stay measured in days, and the hernia width measured in centimeters. Out of these variables, COPD, length of stay, and the hernia width were noted to be statistically significant. Lastly, we have hernia recurrence, ASA classification, wound status, and whether the ventral hernia repair was performed in an elective setting. Most of our patients in both groups belong to ASA classification 3. And interestingly, the wound status that was most commonly labeled was a clean status. And the majority of our patients underwent ventral hernia repair in an elective setting. And out of these variables, the wound status was noted to be statistically significant. Our results show that 28% of the patients experienced SSI, with the most common one being superficial SSI, and 81% of the patients experienced an SSO, with the most common one being a seroma. For these two groups, the most common intervention performed was oral antibiotic therapy. Lastly, 37% of the patients experienced a SSO-PI, with the most common intervention including wound debridement. Lastly, logistic regression analysis was performed, which showed a 10-point improvement in Herqles score was associated with a 4% decrease in the odds of experiencing a SSO, and this was noted to be statistically significant. Although not statistically significant, a 10-point improvement in the Herqles score was associated with a 3% decrease in the odds of experiencing SSO-PI or SSI. In conclusion, subjective and objective measures of success following ventral hernia repair was noted to be correlated with another in the short-term period. However, long-term quality of life may be impacted more by the ventral hernia repair itself rather than 30-day morbidity, which was measured as 30-day wound event in our study. Then, future studies can potentially include investigating correlation between other subjective and objective ventral hernia repair measures in the long-term period. Thank you.